Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
Well, Bob, in our opinion, of course.
That's all that matters, right, Brad? So we're going to talk today how to use a massage gun on calf muscle pain. This is going to be a pretty easy video, Brad.
Yeah,
So,
yeah. It's
When
a good thing, though.
the only thing is, though, when you have calf pain present, I want to make sure that it's not anything serious.
Oh, that's a good
like
point.
a blood clot. You could get DVT, deep vein thrombosis.
Yes.
And in that case, you're going to have probably some swelling, maybe redness, and
Yep.
when you squeeze it, it hurts.
Yep.
Diabetic neuropathy. You know, obviously, although we have found a little bit of circulation to the area does seem to help that.
Sure.
By the way.
Sure.
And arterial claudication. Arterial claudication. I had to say
Oh,
that
that's a
right.
big one. What
Yeah,
are you
that
talking
means
about?
that's also talking about that your blood is not flowing like it should be. A lot of people,
little clogged up
Yeah.
in the arteries, so
yeah, a
to
little
speak.
narrowed up. A
Yeah.
lot of times you'll walk for a while and it'll start hurting. Yeah.
My father had that very
Did he?
clearly. Yep.
Yeah. But now, if the pain is due to a muscle strain or a micro tear, you should first find the area where it's torn. And all you got to do is use your fingers or your thumb and find the spot. Now, often it may be like in the mid calf,
Yeah.
or it may be right where you attach to the tendon.
Down here. Yeah.
Yeah.
I think this place where the gastroc goes, it ends right here, and there's a soleus. That's a fairly common
Yes, it is.
spot in there.
If it's down here on the tendon, we have a different video for that.
Yep.
But what you're going to do is you're going to find that tender area, and I usually like to work from the outside in, Brad. So
Sure.
you're going to
On
massage.
both ends going in.
Yeah,
Yep.
you're going to massage around the area, and then eventually you go into the area itself.
And you'll know if you have a tear or a strain because it's pretty point tender when you get on it, and you have to kind of palpate deep. You're not just going to go on the skin, but it'll open your eyes
Yeah,
up.
you should find a spot. Yeah, and we're going to recommend that when you use massage gun, just no matter which one you use, probably go with the fibers and against the fibers. You can do a little bit of both. So now we have a lot of big variety of massage guns here, but we want to talk about the heads.
Yeah.
So to begin with, if you want to go with one that is very innocuous.
Oh,
that
wow,
is-
Bob.
there
You've
we go.
been looking in the
Yeah,
thesaurus.
yeah, that's right. Is the air-filled one? This one you can take this over bones and it wouldn't even
Yeah,
bother
it's
bony
cushy.
areas. Yeah, it's cushion.
It's a good way to start.
So and then you can get a little more aggressive. Maybe I would say the round one.
Yep. I like the round one for going sideways.
Right.
Which we'll get into in a little bit.
Yes. This one also works quite well. It's not too aggressive.
No, a lot of
it's-
surface area, so
yeah.
it spreads out the force.
If
a
you
little
go
bit.
sideways on this one, it could be a little more aggressive.
Sure.
So, I think for the smaller one, that's all the ones. Now, like in some of these other ones, like the handheld massager, you got this one, which is pretty aggressive. It's got knobs in it and
Yeah.
a large area
Yeah,
too.
spreads it out more large
Yeah.
area, but that one is not as aggressive in regards to the reciprocation,
Right.
the reciprocation of the travel. So that's changes there.
So, Brad, like we said, we're going to go ahead and I like to go over the clothes, to be honest with you. With
Oh,
this
sure,
one,
yep,
With this one,
yep.
because it just feels better.
Sure.
Now, I got an aggressive one. This is the pointer bullet one. You could be on some of them. And I'm going to work away, again, around the area of tenderness.
So Bob's going over his clothes. I'm going
Yeah.
direct skin. You can do whatever feels best for you.
And then start creeping into the area that's painful. And it's nice when you find the area that's painful to actually do cross fiber, to actually go across the fibers.
So the fibers go vertical
Yeah.
on all the calf muscles. So we're going to go actually this way, which
Right.
is
We're trying to do a little cross fiber massage because we're assuming there's some scar tissue that's being laid down.
Yep.
And we wanted to break that up, that scar tissue, and we wanted to get more blood flow to the area. So I think it'll help speed along your recovery.
Yeah.
So the other thing I want to point out, Brad, is I really like to do a little flossing with this tool. So
Dental floss?
yeah, not really. It's floss is movement. So while I'm massaging, I'm going to get started here. I actually like to move the foot up and down
Ah, sure.
and side to side, Brad. So it's just going to get different areas, and it's going to,
So we'll get over that sore spot
yeah,
and then do this motion.
yep.
Yeah,
and
I like
back and
that
forth.
too.
It's just a good way to really get into the muscle and get different areas of it.
And that makes a
So-
lot of sense because when you're active, you're on your feet. You're always
Right.
moving your ankle and working those muscles. So you're going to work the that
I would
injured
do
area.
I would do a little bit of both, Brad. I would do the without movement
Yep.
and of course with movement too. But of course you can throw in some stretches and stuff along with this, but that's not the purpose of this video. The purpose of the video is just to show massage. So,
Yeah, we just put a calf stretching video out just a week or two ago.
yeah. Remember, this video is part of a series of videos on massage guns and handheld massagers. And
Right.
so if you go to bobandbrad.com, go to the giveaway section, I was going to say. Go to the program section and look for the program on massage. We actually have ones on plantar fasciitis, sciatica,
Hip.
hip pain, shoulder pain. I believe that one's
I
done.
don't know, is that one up yet?
Yeah.
If you go in there and they're not up yet, it means we're still loading. These take quite some time
Yeah, they
sometimes
do.
before we get them complete. So be patient. Come back and look at it in actually a week or two.
Watch only the videos that pertain to you.
Right.
And each video has a PDF with it, a printout. You can
Right.
actually print out the contents of that video.
Yeah,
So
you're
don't
going to
have
print out what we're looking at right here on our
exactly.
power screen. So yeah, it's you can't go wrong with that. It just keeps you from coming back and having to look at us again.
And
And
it's all
get,
free.
Not even your email.
Goose egg.
Goose egg.
Yeah.
Wow.
All right.
Infinity sign.
Thanks.